And I'm starting the broadcast.
All right.
It's all you.
Thank you. Good afternoon. This is Martha McDermott with LMHPCO Plus. We welcome you to the Advanced Hospice Management monthly webinar. For those of you joining us today for the first time, let me introduce our host, Advanced Hospice Management. It is America's premier hospice-only third billing solution. Their team of professional billers have over 75 years of combined experience in hospice billing. They are highly skilled in the use of many software programs and work with all Medicare MACs across the country, as well as commercial payers and state Medicaid and managed care programs. They can collect more of your money and collect it faster, giving you predictable cash flow, allowing you to focus on providing the highest level of patient care. With their service, you can always have a dedicated team of the billers managing your claims and collections, and your cash flow is never interrupted by staff turnovers, illnesses, or vacations. To learn more about Advanced Hospice Management, you may contact Sales Director David Stetson at david@HOSPICEMGMT.com or the CEO, Delane Henry, at dh@hospicemgmt.com. Thank you for joining us today. I'm Martha McDermott again with LMHPCO Plus. I'm a part of the consulting division of the Louisiana, Mississippi Hospice and Palliative Care Organization. I have over 42 years experience in health care and management that covers acute, long-term care, and hospice. Thank you for joining us today, and we will begin the presentation. You'll be able to ask questions today. However, if we don't get to your question for one reason or the other, please leave your question and we will follow up in an email to you. Today's topic is the self-determined hospice cap for 2015. Excuse me while I move the slide. This presentation is for informational purposes. Neither parties, Advanced Hospice Management or LMHPCO Plus, have a shared financial relationship with or interest in commercial interests between the two parties. It is at the discretion of the participant to use this information to his or her own use. Again, welcome to our presentation. Today, the topics that we're going to cover are the time frames for the self-determined hospice cap. We'll be looking at how you calculate an agency's cap, what PALMETTO GBA's instructions are for the self-determined hospice cap, and the provider's necessity of compliance. Please note that this does not cover areas related to the inpatient hospice cap requirements. To give you a little background, as many of you probably know, hospice was initiated under the Medicare hospice benefit in 1983. The aggregate hospice cap was designed to protect Medicare from spending more for hospice care than conventional medical care by limiting the total aggregate payments a hospice can receive in a year. And as you know, when we think about a year, it's not a calendar year, it's the federal fiscal year that we go by. In this instance, for 2016, it is from November the 1st of 2015 through October the 31st, 2016. As of 2014 and every cap year since that time, hospices were mandated to calculate and self-report their cap amounts to their max. In our instance, it would be PALMETTO GBA that we are reporting to. The calculation period. The calculation period should be made no sooner than 3 months following the close of the cap year and no later than 5 months following the close of the cap year. And the intent here is to capture as much revenue that was paid during that period of the wage index year. And essentially, the way you account for the cap is the number of patients times the CMS designated cap amount, which equals the allowable payment that the hospice provider could have received within the wage index year. Self-reporting cap timeframes. Providers will consider Medicare revenue received for the period of November the 1st, 2015 through October the 31st, 2016. The self-determined hospice cap is due to PALMETTO no later than March the 31st, 2017. I cannot express how serious this is for providers to get their cap reports in to PALMETTO by the 31st of this month. Filing a self-determined hospice cap. PALMETTO GBA requires that providers use a specific one-page form. Below on this slide, you will see the website that you can go to and find your instructions. It just so happens today, if you are enrolled in PALMETTO's listserv, there is a reminder in the email today about this information. Calculation of the self-determined hospice cap is going to be determined by what the hospice chose as their cap methodology. So a hospice agency, a licensed hospice agency, is either a streamlined methodology or a proportional. So the first thing we're going to consider is you need to know what you're using in your agency. Is it streamlined or proportional? The wage index of 2012 gave providers the opportunity to continue to use the streamline. That is the methodology that we began with when Medicare hospice cap rates were introduced. Or you could move to proportional. And this was a one-time only choice. Providers were given the choice to stay with streamline or proportional. Once you make the decision, or once they made the decision to move to proportional, there is no going back and returning to former methodologies. So if I chose proportional, I could not now go back to streamline. Now, hospices that came on after that time frame of the wage index of 2012 had no choice. They were automatically became proportional providers. So how do you look at these two types of providers? First of all, in the streamline, you must count your patients between the period of September the 28th of 2015 through October the 31st, 2016. And what you're looking at in this scenario are patients who were admitted to your service, and this is their first time wherever they have ever elected hospice. Now, sometimes you have patients come from other agencies that were admitted to your agency and your Streamline. You can go in and look at your PS&R report, and we'll discuss that further in just a few minutes. I think you could probably find this information in the Common Working File or HEPS. If you know that you are sharing a patient, you can go back and look at your days, because you're going to be given a fraction of that patient to use in your calculation of monies that you should have received within that time frame. So let's have an example here. Mrs. M elects hospice for the first time on August the 21st, 2016, and expires on April the 17th, 2017. So we are only able, under this methodology, to count Mrs. M one time as a full patient in the 2016 wage index. Now, in this example, I'm assuming that Mrs. M has only been in my hospice during that period. She hasn't had any other hospice stays. I'm just trying to make this can be very confusing, so I'm trying to make this as simple as possible. Proportional methodology. In this particular situation, you're accounting your patients that are admitted November the 1st, 2015 through October the 31st, 2016. A patient-by-patient proportional count includes only that fraction which represents the portion of total patient days of care in all hospices in all years and that was spent in the hospice in the CAP year. That's a mouthful, and it gets really confusing. So I'm trying to keep these examples as simple as I can. Mrs. C is admitted on October the 20th, 2015, and expires on December the 31st, 2015. As you can see, she's in between two CAP periods. The proportional methodology provides for counting a fraction of Mrs. C's days for the wage index years of 2015 and 2016. In this example, Mrs. C had 73 total hospice days. So using Mrs. C, 1 as a whole number in the count of the hospice amount allowed for wage index years of 2015 and 16, we can count 0.16 of Mrs. C for wage index year 2015. And for the wage index year 2016, she is counted as 0.84, because with your CAP years, you ended October the 31st for wage index year 2015, and you begin a new wage index year November the 1st, 2015. Hospice self-reporting cap is fixed by the federal statutory hospice cap amount for the 2016 wage index. And for this period, it is $27,820.75. So you're looking at the total number of patients who elect hospice during the specific methodology of payment. You take that amount and you multiply it by the statutory cap of the $27,820.75. The multiplied amount is compared to the Medicare monies that you receive for that time period. As an example, an agency admitted 73 hospice patients. So you would take those 73, and we're assuming these 73 are whole number of patients, you're not having to fracture them out, times the 27,000. So the allowable revenue that hospice agency could receive during that wage index year is $2,030,914.75. However, in this example, the agency collected over $2,975,346. Based on this example, the agency is over the allowable cap. The agency must repay $994,431 by March the 31st of this year, or make arrangements with PALMETTO GBA. Another example, and this is where you've got patients that you may not get a whole patient account of them, a whole number of one, but you may have fractional patients. Based on this example, 24.783 hospice patients were admitted. We take that amount again, times the $27,820, for a total payment of $689,481.65. In this particular example, the agency only collected $650,698 in the wage index year from Medicare. They are under the allowable cap. The agency is not responsible to make any payback because they are under the cap. PALMETTO issued letters to hospice providers around February the 28th, 2017. Once again, the letters provide specific information on filing a one-page report. I believe it is still on an Excel spreadsheet, but this is what you will do to do your self-determining hospice calculation. All providers should follow all steps. Even if you're under the cap amount and you're comfortable with knowing you're under the cap amount, you still need to file your report by March 31st. If not already established, providers should enlist in the EDIM, or Enterprise Identify Management System. You will need to enroll in that so you may be able to access the Provider Statistical and Reimbursement Report, or the PS&R for EDIM. If you've utilized this particular report for CAPS, you're already for your annual cost report, you're already established in that system. However, if you're not, you need to do this as soon as possible, because when you go to apply for this, there are certain documents and certain people that you must appoint within your organization prior to being eligible to receive PS&R data. You'll see this is an example of what it looks like when you arrive at the CMS portal. And you will go from here to sign up for your PS&R. When PALMETTO sent out these letters, they were providing you with information that they had at hand at the time they wrote the report. I saw one CAP letter notification that the letter was written around February the 17th. So when PALMETTO sends that information out to the provider, they have the number of patient count and monies received to date. And you are told, I believe, in the letter that you can use that information when you are filing for your CAP report to them. But utilizing the PS&R report will provide the most currently known hospice patient count, because the hospice patient count is going to be vital in you calculating if you were over or under for 2016. Necessity of compliance. PALMETTO will issue a late notice letter and withhold provider payments if the self-determining hospice cap is not submitted by March the 31st. A provider who exceeded the allowable cap will be expected to send a payment to PALMETTO when filing the self-determining hospice cap. Or you may request an extended repayment schedule with PALMETTO. There are instructions on how you do this in your CAP letter. But you need to proceed as soon as you can in getting your PS&R information, because it could be detrimental, quite detrimental, if you had to pay back a significant refund back to PALMETTO by the 31st. Again, calculate your cap as soon as possible. All right, once you've got your cap off, you email it and you're finished. And PALMETTO will spend the next 3 years reviewing your 2016 the next year reviewing your 2016 wage index, and you will get a letter saying that you were under or you were over. If you are over, they will tell you what you were over. Now, PALMETTO also has a 3-year window of time to recalculate a hospice agency's cap. And I would assume that that's done because if you're sharing patients, they have to have enough allowable time to review other providers' cap information and come to a final decision. I hope this talk today and webinar has been informative. Does anyone have any questions at this time? Thank you for joining us today. Thank you to Advanced Hospice Management for hosting this webinar. Here's the information for LMH PCO Plus. We welcome your calls and we welcome your questions. Here is our information. My partner is Ann Walker, and her email address is ann@lmhpco.org. And I'm Martha McDermott at martha@lmhpco.org. Thank you for being present today. We appreciate it. Grant, I'm turning it over to you.